Dr. Nitin Shah is the head of Department of Pediatric and Pediatric Hematology at PD Hinduja Hospital. He was president of Indian Academy of Pediatrics in 2006. He given more than 2,000 guest lectures, more than 230 research papers, and many more. Over to Dr. Nitin Shah and our respected Dr. Prashant Trivedi sir. Prashant Trivedi sir is a past president of Association of Physicians of Rajkot. He is a mentor of all of us, Dr. Prashant Trivedi sir and Nitin Shah.
Good afternoon, everybody. I think we are between you and the lunch, but Dr. Nitin Shah is an ocean of knowledge, and we would do everything. We would swim, we would snorkel, we would do scuba, everything to get the pulse out of him. Before starting, I would like to tender that I may ask very silly questions to you, sir, so please bear with us.
Please go ahead.
As we know, sir, that there are lots of febrile illnesses, and still the most common febrile illness is typhoid fever.
Yes.
So, sir, we would like to know which are the typhoid vaccines and which is the new conjugate typhoid vaccines available.
Correct. So we started with I'm sure people who are practicing for more than 30, 40 years would know that we used to have TAB vaccine. Then we used to give TAB with cholera. That was unconjugated wholesale typhoid vaccine. But that fell into disrepute because the efficacy was poor and the side effects were high. So from there we have now moved to conjugate typhoid vaccine. So now all vaccines that we have and we should use are the VI polysaccharide conjugate typhoid vaccine. And there are 3 or 4 brands available. The most important brand which has several efficacy trial across the world is the one which Bharat Biotech makes, which is known as Typebart TCV. And why I'm taking the name of that vaccine specifically is because that is one vaccine which has now studied up to 85 years of age people. So like all of you are physicians and all of you are like old like me. I am more than 60 years. I'm sure many of you are more than 50 years. So typhoid is one disease where it is quantum based, which means you eat a pani puri full of typhoid germs, you will get typhoid no matter what your age is. So generally typhoid is the disease of young people, school going and adolescents. So now you can protect yourself against typhoid by this typhoid conjugate vaccine up to the age of 85 years. Today the label is for 65 years, but the label will very soon change because the Drug Control General of India has been submitted the report for 65 to 85 years, and when that happens, it will be from 6 months to 85 years. You take 1 dose as adult, whereas children we give 2 doses 4 years apart. Efficacy is excellent, more than 90%. It works against typhoid, works against drug-resistant typhoid, and lots of benefit that you don't get typhoid. Of course, you know, rare side effect of salmonella is also known to lead to gallbladder carcinomas and things like that. So I think we are, as much as Hindustan, we are malaria stan and typhoid stan. So I think all of us should be protected against typhoid.
Sir, what is the dose schedule?
So dose schedule for adult is just 1 dose anytime in your life, because we are already probably exposed to typhoid in past and we will continue to be exposed through contaminated water and food. For children, we normally give first dose between 6 to 9 months of age and the second dose 4 to 5 years after the first dose.
In adult, do we need a booster or a second dose?
So normally no, we say because once you are primed against typhoid through your natural immunity, this first dose itself acts as a booster and probably it will see you for many, many years against typhoid.
Now, sir, coming to influenza, we have many influenza vaccines available.
Yes.
Which will be the best vaccine and which is the best time to take an influenza vaccine?
Correct. So first of all, you have 2 types of influenza vaccine. One is a live attenuated intranasal vaccine, which was available, then not available, and now again is available through what is known as MyLab. MyLab is a subsidiary of Serum Institute of India, which markets the live vaccine. Now the live vaccine has a very good efficacy, but it can be used only from 2 to 50 years of age, not beyond. It cannot be used in immunocompromised because it's a live vaccine, and the efficacy is good. It has to be given in both the nostril 0.25 ml through a syringe. Some people don't like because it leads to stuffiness of nose, so they almost say that it's better to get influenza than to take the vaccine, but it's a good vaccine. Most important and the most widely used vaccines are the inactivated influenza vaccine. You have quadrivalent vaccine today, but very soon, maybe in the next generation, it will become again a trivalent. So the quadrivalent has the H1N1, which was the pandemic H1N1 started in 2009. That strain, it has one strain of H3N2. These are the two important. It also has both the type 2, Yamagata and Victoria. Now one of them will be dropped because we are not seeing for last 5 years Victoria, so only Yamagata will remain. So whether it's quadrivalent or trivalent doesn't matter, use one which is available. The best time to give influenza vaccine is before the influenza season. In our country, the influenza seasons are two types. One is before monsoon, so it starts in July, August, September, and you see a sudden spurt of very high fever, cough, cold patients. And one in winter, which is more common in the northern part of the country like Kashmir, New Delhi, and in the southern part like Puducherry, Tamil Nadu, where the monsoon is little late. So according to your area, you use the vaccine before the season starts. So for Gujarat, Maharashtra, it will be pre-monsoon, so that's known as southern vaccine. Influenza vaccine comes twice in a year, northern and southern. Southern comes now, it has already come in March, April, which to cover the monsoon. And a northern vaccine comes somewhere in September to cover the winter peak. So don't wait for the ideal vaccine. For the first time when the patient comes, use what is available, and next cycle onward, you change him to southern type of vaccine. So I'm sure all of you should take the vaccine for 3 reasons. One, many of you are above 50, you may be having some lifestyle disease like diabetes without your knowledge, so you are at risk of severe influenza. Number 2, because you are a medical professional, you can infect your patient who may be immunocompromised. So, and you may have some children at home who can have very severe influenza. So all the medical professionals should take every year influenza vaccine without fail just before the monsoon.
So there is a Hoskins effect which is said in influenza vaccine. What is that Hoskins effect and how does it...
I am not aware of what effect you are saying, but I mean, if you can elaborate, I can answer that. What is the term Hospia? I am not sure about that.
Yeah, they say that if you go on taking influenza vaccine every year, the efficacy of the next vaccine will...
Oh, no. That's not proven. I mean, people, US was the first country to say annual influenza vaccine for the entire population from 6 months of age onwards till whatever age you are for last 20 years. And it has never been shown that the efficacy changes drastically. So what you're saying is true for polysaccharide vaccine. Like any polysaccharide vaccine which is unconjugated, you take repeated doses, the efficacy goes down. But that doesn't happen with inactivated influenza because it's not a polysaccharide, it's a protein-based vaccine. So yes, if there's a mismatch between the circulating vaccine type, circulating influenza wild type and the vaccine type, then the efficacy can be very poor in some seasons. So if you say, like in a study of last 10 years, at least 3 to 4 times there will be a mismatch. So the influenza vaccine efficacy will not be as high as during the time when there is a perfect match. Because you should remember, vaccines are made at least 8 months before the season starts. They are made on the samples given by WHO based on the circulating virus then. But in the next 8 months, the circulating virus may change because these are hyper-mutable virus. That's why you need annual influenza vaccine. So by the time the vaccine comes and the strain has changed, it's your bad luck for that year. But otherwise, generally, at least in last 10 years, since last 6 years, at least since COVID, there has not been a single season where there is a mismatch. So the effectiveness against severe influenza, I'm not talking about common influenza, severe influenza which leads to hospitalization and mortality, especially if you have high-risk disease like cardiovascular disease, metabolic disorder, cancer survivor, stem cell transplant, etc., or a very elderly population, that is prevented to the tune of 80 to 90%.
Sir, what is the new hepatitis B vaccine, Heplicib?
Okay, so there are two new hepatitis B vaccine. One is for adolescents and adults, which is just 2-dose schedule. And it is better than giving 3-dose schedule with a better efficacy. There is one more which has the hepatitis surface antigen plus the pre-S1 and the pre-S2 antigen. So, like if you see hepatitis B vaccine when it started, it was plasma derived, right? Then it became recombinant. The plasma derived vaccine by nature had contamination of pre-S1, pre-S2. So, you know, if you give 100 people hepatitis B vaccine, 98% will seroconvert, but 2% will not seroconvert. You give them 3 extra doses, some of them will seroconvert, but some will still remain not seroconverted. They are known as primary vaccine failure because they do not recognize the S antigen and respond with anti-HBs antibody which are protective. Now when they are given vaccine with pre-S1 and pre-S2, they will react to the pre-S1 and the pre-S2 antigen and will develop pre-S1, pre-S2 antibody which will protect them. So the primary vaccine non-responders will respond to the pre-S1, pre-S2 containing vaccine, and this type of vaccine are not available in our country, but they are available in United States and in Australia. So for some of you, medical professionals who are exposed to hepatitis B virus now and then, and if you have taken hepatitis B vaccine, not 3 but 6 doses, and yet your anti-HBsAg antibody is 0 or below 10, you need that vaccine, somehow get it from somewhere and take that.
Most of us must have taken the hepatitis vaccine many years back.
Correct.
Now, do we need to check our anti-HBsAg titer?
So you don't check antibody titer routinely after vaccination because you are giving it to every child, every adult or every intern. So normally you don't do it. But for a medical professional, I will insist that they should do an antibody titer after 3 doses. Why? It is not important what your titer is. Whether it is 20 or 20,000, it does not matter so far as once you have seroconverted. But if you have shown seroconversion above 10 MIU per ml of anti-HBs antibody after 3 doses, that means you are primed and protected. In future, you have a needle stick injury, you don't have to worry even if your antibody titers have become 0 that time. But suppose you have a needle stick injury today, you have taken vaccine 10 years back, now your antibody titers you will check is 0. You don't know it is 0 because it has fallen to 0 or whether you did not respond. So now what you will have to do, you have to hepatitis B immunoglobulin, you will also start vaccination, and then you check again your seroconversion after 3 doses. Mind you, hepatitis B immunoglobulin 0.06 ml per kg, some of you are like 70-80 kilos, it would be 7 ml, 8 ml, very painful to take and extremely expensive. One dose of 0.5 ml costs 4,000 rupees. Imagine you take 6 ml, that is like 12 bulbs into 4,000, 50,000 you will spend. You would repent. If you had done the antibody titer, it would have been better. So from that point of view, the titers are important, but not from a point of view of public health.
Sir, how good is the new zoster vaccine which is now available?
What is the new?
Zoster, herpes vaccine.
Zoster?
Yeah.
Okay. You think varicella, zoster?
Yeah.
Okay. I think this is an important vaccine. I don't know how many of you have taken. Anyone who is above 50 and has taken the vaccine, please raise your hand. Okay, I see only 2 or 3. Or anyone above 50 and having not taken the vaccine? Be honest. Okay. So this is, so you know what is zoster? You develop chicken pox or varicella, that is varicella zoster virus. Once you get varicella and you recover, the virus does not disappear from our body. It takes shelter into the posterior nerve root ganglion for your life. It's a good cohabitation between the virus and the body, both remain silent. Till the time you become immunosenescent, which means after the age of 50, your immunity starts going down year by year as your physical activity also goes down. So when your immunity against that zoster virus becomes less, it gets a second chance to come back, but because it is not like you are totally naive, so it doesn't come like a second chickenpox which is generalized, but a localized dermatomal involvement. Unless you're immunocompromised like HIV or a transplant patient, it can become multidermatomal, but generally it's unidermatomal, and it leads to those blisters which recover in 90%, 99%, but what is important is the post-herpetic neuralgia, which can be pathetic. And it can lead to even suicidal tendencies in elderly people. And if you have ophthalmic involvement, then you can have problem with the eyesight. So from that point of view, you should prevent zoster. So anyone who has had varicella in the past and now are above 50 years or are between 18 to 50 years but are immunocompromised should take zoster vaccine. 2 doses, 1 to 3 months apart, painful, can lead to high fever. Take it on a Friday or Saturday when you are not going to practice, but it is worth the pain of the vaccine which lasts for a day or 2 than to suffer from post-herpetic neuralgia which can remain for months to years. Now with the current zoster vaccine, Shingrix from GSK, which is not a live vaccine unlike the MSD's vaccine in the past, which was Zostavax, which had a very efficacy for only 3 to 4 years and by 5 years the efficacy was 0, whereas with this Shingrix vaccine of GSK, we have 8-year long-term follow-up on effectiveness. The efficacy is as high as 95% in the first 5 years and still remains at 80-85% till 7 years of follow-up, including in people above the age of 70 and 80 years. So that's an extremely good vaccine because it's a recombinant vaccine of 2 proteins and a very strong adjuvant, which is the ASO4 adjuvant of the GSK. It's a trademark of GSK, and that's the reason why it's a very potent vaccine, extremely effective. Everyone should take it. Expensive. It costs around 8,000-9,000 rupees per dose, but it's worth it because believe me, if you have someone in your family who had post-herpetic neuralgia, especially little older, 60, 70, they have a very poor quality of life because they keep on getting pain, itching, they can't sleep at night, and so on and so forth. So the value of the vaccine is more in preventing post-herpetic neuralgia rather than only zoster alone.
Sir, should it be taken in somebody who has already had herpes zoster once?
Yes, because of 100 adults, 15 to 20 will develop zoster in their lifetime by 60 years, and almost 50 to 60% will develop if they live enough till 70, 80 years. Those who have had zoster in the past, 15 to 20% have recurrence. So that's the reason why you have to take the vaccine even if you had zoster in the past. And all those who have taken zoster vaccine in the past, the live vaccine of the MSD, they still have to take zoster vaccine of GSK because, as I said, the zoster vaccine was not that effective for long term, whereas this vaccine is extremely effective for the long term. It is important because this vaccine being a recombinant vaccine, it is safe in patients who are immunocompromised. So Zostavax could not be given to transplant patient, HIV, patient on steroid, etc., where this vaccine is safe even in those immunocompromised. In our country, the license is only about 50 years of age because the company has not done study between 18 to 50 in immunocompromised, but internationally the license is from 18 years of age for 18 to 50 if they are needing because of immune compromising condition. So if you are a patient of transplant, patient of steroid, HIV, etc., you need to take a written consent, what you know, off-label use. It's not illegal, it's off-label. You have a written consent that explain this vaccine is good for me, this vaccine is also licensed for me internationally, so my doctor is giving me and I'm ready to take the vaccine, take the written consent, keep it with you, and you are perfectly okay to use it in that condition.
If somebody never had an attack of chicken pox,
correct,
should that person take vaccine?
So anyone who didn't have varicella in the past, first of all, varicella, you will never know whether you had it because you usually have it as a child. So you have to ask your mother or the grandmother. And I always say that a grandmother never fight with her when it comes to diagnosis of measles and varicella. She is always smarter than a fresh pediatrician who have come out of MD Pediatrics and started practice, because 9 out of 10 the time grandmother will be more right than the doctor. So that's number one. So you have to ask your mother and the grandparents whether you had. Suppose you didn't have or you didn't know, you do your anti-varicella antibody. If your anti-varicella IgG is negative, which means you either didn't have it or you have lost the antibody, you presume you didn't have. If you are below 50, take varicella vaccine. If you are above 50, straight take zoster vaccine.
Okay. What is the guideline for taking pneumococcal vaccine in adults without any comorbidity?
Correct. I think this is an important question for all of you. I mean, I know a surgeon, pediatric surgeon, who had pneumococcal meningitis, absolutely hale and hearty like me. I mean, I am also very hale and hearty, you can see. I am 65, don't go by my color of hair, I just dyed it yesterday. So, he had pneumococcal meningitis, diagnosed within 6 hours because he had headache, splitting headache and fever, evening LP done, started on ceftriaxone, survived. But delay could have led to mishap. So, pneumococcal disease is a common cause of mortality of LRTI in adults, especially if they are elderly above 65, between 50 and 65 if they have at-risk condition or immunocompromised. And between 5 years or 6 years to 50 years, again if you are immunocompromised. So this is a vaccine which is like womb to tomb. So you give it to a child as small as 6 weeks as a primary vaccination, and it is part of a national program today for children till time you are as old as you are. So which vaccine you use? So only vaccine which is licensed for adult is either the conjugate vaccine, which is Prevnar 13 of Wyeth of Pfizer, and the polysaccharide 23-valent vaccine, which is available from 2 or 3 different companies. So the dictum is, in our country, Prevnar 13 is licensed from 50 years of age onwards. So all above 50 should take only 1 dose. Then if you are not having at-risk condition or you are not immune compromised, you only take that 1 dose and that's it. Then when you become 65, you take your first dose of polysaccharide 23-valent vaccine, and they take 1 more dose of polysaccharide 23-valent vaccine when you are 70 years. That means 5 years after the first dose. And after that, you don't take the 3rd dose. But the sequence should be first the conjugate vaccine and then the polysaccharide. So suppose you are diabetic and you have not taken anything. Don't take polysaccharide first and then conjugate, because then the conjugate vaccine will not work as good. First take the conjugate Prevnar 13, and then after 8 weeks you take the PPSV 23 vaccine. So this is the type of schedule that you use. Some of you would have heard about higher valency conjugate pneumococcal vaccine available in the international arena, not in India. It may come very soon. You have what is known as PCV 20, Prevnar 20 from Pfizer, available in USA and Europe, not available in India, will come in next 6 months. And you have one 20-valent vaccine from MSD, so which is again a conjugate vaccine available in USA and UK, not in India. Now, if you go abroad to USA and you are able to take the PCV 20, then take that. Don't take Prevnar 13 here, because once you take Prevnar 20, you don't have to take the polysaccharide vaccine at all in your life. But do not take the MSD's 20-valent vaccine, because it is a completely different serotype seen in adults in USA. USA, as you know, is using Prevnar 7 followed by Prevnar 30 right from 2000. We are in 2025. So 25 years, those vaccine serotypes have disappeared. So MSD has made a different adult vaccine with a completely different serotype which are seen in adults. In our country, the pneumococcal conjugate vaccine is just being introduced in national program in children. So those serotypes are still prevalent in adults. So adults should take a Prevnar 13 or a Prevnar 20 and not the MSD 20-valent vaccine.
Right. If somebody is embarking upon long-term immunosuppression,
Yes.
which vaccines they should take before starting immunosuppression?
So all those who are immunocompromised, if you can postpone your immunocompromising conditions like the drugs like steroids or mycophenolate or whatever, then you finish all your live vaccines at least 6 weeks before you start immunosuppression, because once you are on immunosuppression, you cannot take any live vaccine. Which are the live vaccine? Live hepatitis A, MMR vaccine, varicella vaccine. These are the live vaccine. And of course, if you are trying to go to South Africa, not South Africa, African countries like Kenya, you need yellow fever, which is again a live vaccine. It is contraindicated in immunocompromising individual. But all killed vaccines also may not work as well once you start your immunosuppression. So if you have to start immunosuppression, and if you are able to avoid for next 1 or 2 months, finish your vaccination. Which vaccine you should take? Influenza, zoster, pneumococcal. These are the 3 vaccines which you must take before you start immunocompromising drugs. And you can take 3 dose vaccines, 4 vaccines, 5 vaccines at the same day. Students who go abroad, who come to us, we give them pneumococcal, meningococcal, HPV, Hep B, Hep A, whatever vaccines are required as per the university on the same day, because they don't have time to fly. So you can take 1, 2, 3, 4, very easy. Never give any vaccine or any injection in the buttocks, because it will not work and can have side effect. Especially rabies vaccine, hepatitis B vaccine given in buttocks is absolutely waste. It has to be repeated. So you can give 4. If you have to give 6, then you can give 2 in each arm, keeping 1 inch gap. And that's how you can give even 6 or up to 8 vaccines to a person, no harm at all.
What vaccines to be taken when somebody is planning pregnancy? So before planning pregnancy?
Correct. So during pregnancy, except rabies vaccine and influenza vaccine and Tdap vaccine, these are the only 3 vaccines which are given during pregnancy. That too not in the first trimester, after the first trimester is over. Any other vaccine, there is nothing urgent, so you should wait. So before pregnancy, you can finish your MR or MMR if you have not taken, because you don't want congenital rubella syndrome in your baby, and you see that for 1 month, 4 weeks, the lady does not become pregnant. So she should take at least a month before pregnancy is planned. During pregnancy, first trimester, nothing. After first trimester, she will take rabies if she is exposed to, but she will take influenza vaccine and Tdap during pregnancy. And Tdap should be given at least 4 weeks before the date of delivery, so that there is good transfer of the anti-pertussis antibody to the baby to be born. And suppose any of the vaccine which is not taken can be given at the time of discharge, especially the HPV vaccine. If not given by the lady, you give it at the time of discharge. Why not after discharge? Because there is so much of fun in the family, new baby has come, everyone is busy celebrating, birthday cake, this, that, and the mother forgets that she needs to take a vaccine. So it has been proven that the compliance falls to 50% if you miss the bus of giving vaccine on the day of discharge. So on the day of discharge, you can give the vaccine.
And what vaccine should be taken by all healthcare professionals?
Correct. So same, I said, influenza every year without fail, even if you are healthy, because it's not for you alone, it's also to prevent transmission to your patient. Especially if you are an oncologist, you are an intensivist, or you are diabetes specialist, chronic renal failure patients you are seeing like nephrologists, you can transmit it and they can die of that. Pneumococcal, after the age of 50 years, you take 1 dose of Tdap if you have not taken in your life. So at 50, you celebrate your 50 years because by 50, whatever you have done is done. You can do nothing new in your 50. By 50 years, maybe your children are settled. Now you should think of your life and not only for children's life, but you should also think of your health. Get your health checkup done for diabetes, for renal failure, maybe a PSA for a man, a mammography and say Momosono and a pap smear for the woman if she has not done. Do your sugars once in a while, maybe a stress test, etc. Tdap vaccine, influenza vaccine, pneumococcal vaccine, and zoster vaccine.
Will we have a dengue vaccine soon, sir?
Which one?
Dengue vaccine.
Sorry, can't hear. Dengue vaccine, oh yeah, dengue vaccine. So the first generation dengue vaccine was from Sanofi, which came, Dengavaxia, tried in Philippines and Mexico, but it fell into disrepute because it increased the mortality in children who were given the vaccine if they were seronegative to start with, 3 to 4 years after they took the vaccine. So that vaccine is sort of withdrawn. Now you have the second vaccine from Takeda, which is an extremely good vaccine. It is more than 90% effective against severe dengue. That dengue vaccine licensing is being done in India. It's already available in more than 8 countries, part of the national program in many of these countries. And that vaccine will come very soon in India. It will be for children from 4 years of age onwards, up to 15 years adolescent, because adults may or may not need it, but the vaccine is going to be licensed till 45 years of age, and the studies are going on for making it even up to 45 years of age. So you will need 2 doses 3 months apart of that dengue vaccine, and probably once that comes, it's going to be hit, because as we saw during COVID time, COVID vaccine was need of the community. People stood in line in public health, whereas other vaccines you keep on telling they don't take. A diabetes, a myocardial infarct, bypass will not take pneumococcal vaccine because he doesn't know what is pneumococcal, whereas he saw COVID death. Same way dengue everyone knows. So once that vaccine comes, it will be like taken up by like hot cake. So I hope it comes very soon because it will save lives. And a third generation vaccine, what is known as Butantan vaccine from Brazil, the license is given to Panacea Biotech and some other 2 more countries to make it. It's a single dose vaccine. So again, when that comes, it will be very good for human beings to save lives.
Sir, who should take preventive rabies vaccine?
So we say all children should take preventive vaccine because they are exposed to dogs and cats without their knowledge that they can get rabies. We are scared of animals, they are not. They will come and touch, they will put their hand in the mouth, etc. Especially if they are staying in slums or chawl type area where there are community pets, but those pets are not vaccinated. Anyone who has pets at home should take a preventive prophylactic rabies vaccine. Why advantage? Number 1, only 2 doses, 0 and 7 days. And once you've taken a pre-exposure, you have a re-exposure, you need only 2 doses, not 4 or 5, and you don't need the local monoclonal antibody which is so expensive. So there's a lot of advantage of taking a pre-exposure rabies vaccine, especially if you are exposed to animals like morning walkers, milkmen, postmen, and name it. I mean, one of the very famous person, CEO, I forget which company, he died because he was pushed by a dog and he hit a stone and he died. So of course not of rabies but something beyond. So everyone who is likely to be exposed to any animal should take a pre-exposure rabies vaccine.
Thank you so much, sir. There are lots of more questions to ask, but I think in benefit of time, we'll have to end here.
Thank you. You did a wonderful job as a moderator, I must say. Thank you. I thoroughly enjoyed. Thank you, APR, for calling me here yet again. I was there in Jimakon last year. Good to come here again. Thank you. My special thanks to Dr. Yagnesh Popat for inviting me here.
Thank you. Thank you.